Is here, radial artery. Okay. Where is carotid? You got it here. Where is brachial? Hi. Here. Okay. Where is popliteal? Back of knee. And so these are the ones that you need to know. For what do you use? Radial artery you use to check pulse. Okay. Carotid, when do you use? Usually? Huh? Yes, when to do CPR. Okay? To do CPR. When someone is unconscious, then you start CPR. Yes? Before you start, you check what? The carotid. Then, brachial, when do you use? For blood pressure measurement and for infants. In infants, you don't go and check the radial, okay? In infants, you go and you check the brachial. The brachial is better. So it's used for two purposes. One, when you do blood pressure, and the second one, for infants. Okay. The rest, popliteal and the leg arteries, usually they are used if you think that a patient has peripheral arterial disease, PAD. If you think that a patient has PAD, PAD means what? Peripheral arterial disease. Okay. You know, it's like CAD. CAD means not Canadian dollar, okay? I wish it is Canadian dollar. CAD is what? Coronary arterial disease. Coronary arterial disease. Okay? Coronary arterial disease means when the coronary arteries of the heart are what? They narrow. Okay? So that they are unable to pass what? Blood. But peripheral means other than the coronary, if any other of the arteries in the body are getting narrow, then it's called PAD, which is peripheral arterial disease. You see, one thing can speak of the other thing. If someone has PAD, he might have what? CAD. If someone has CAD, he might have what? PAD. Okay, they are interrelated. Okay, that's why. So people, when they are checked for PAD, then they should also be checked for CAD. Okay, so the two most important terminologies here are what we call tachycardia and bradycardia. No one should come out of this room without knowing the terms bradycardia and tachycardia. Okay, what is bradycardia? Slow heart rate. Yes. What is tachycardia? Fast heart rate. Okay, anyone knows now this one? Everyone knows? Tachy, brady. Okay, you can see the pulse rate. What happens as the age increases? What happens? Is that increasing or decreasing? Huh? Decreasing, you see. So the highest pulse rate is in newborns, 120 to 160, and it's increasing as the age increases. Okay, and in athletes, what happens in athletes? Huh? It's really so hot, slow. So usually the athletes pulse. So let's say if someone you get like you do here, usually they ask me the pulse rate is so slow, 48 and so on. So it doesn't mean it's not normal. It's abnormal. Okay, but it's what? It used to be called like this, normal but abnormal. Okay, it's not really, I can't say it like abnormal, but it's a variation of normal. Okay, so that means if the pulse rate is between 40 to 60, this is called usually this is called sinus bradycardia. Sinus bradycardia. It's called sinus bradycardia. Usually they don't have rhythm problems. It's like a normal variation of slow heart rate. It's called sinus bradycardia. So abnormal or irregular heartbeats, they can be caused by many factors like this. Can you see? Yeah, I know. Stress. Yes, stress, our friend, stress. Caffeine this morning. How many cup of coffee? Yeah, that can cause what? Increase fast heart rate. Nicotine, yes. Certain medications, overactive thyroid. Exercise, yes, because after you exercise you will have a bounding heart rate. Hyperventilation, fever, diabetes, cocaine, low oxygen levels in the bloodstream. Why does low oxygen level cause fast heart rate? What kind of mechanism is that?
Your heart's trying to pump in more oxygen, so it's working more.
Yeah, because there is low oxygen, then the blood tries to compensate to get more oxygen, yes, and the heart starts what to beat fast, so that to compensate that low oxygen. So people who are living at a low oxygen level area, their heart rate will be what? Higher. Yeah. Okay. Okay. Now I take this short quiz only on vital signs, like take